Thanks for joining the Key Concept session for Community Information Integration and Central Patient Attachment Registry, the CII CPAR program. This session will focus on the CII CPAR Community Encounter Digest Report. The Community Encounter Digest, or CED, is a CII report displayed in Alberta Netcare from participating community providers and teams. It is a rolling snapshot of encounters the patient has had with CII CPAR-enabled clinics over the last 12 months. Please note, only select data from community EMRs form the CED report. It is not the full patient chart, nor is it a patient summary. Instead, this report reflects episodic data. Let's look at a sample CED. The Community Encounter section will record the encounter date and location, the provider's name and role, as well as the reason the patient booked the appointment in the scheduler. You will also see the clinical assessment. It is here where you would see ICD codes, as well as any free text related to the diagnosis if the provider has entered this type of information. In the health concern history, this is where you will see the entries made from the problem list during the encounter. Again, not the full problem list, but what the patient presented during that visit. In the possible allergy section, you will see any allergen entries made only during the encounter. In measured observations, you will see things such as the BP, height, and weight, and the source is a clinic where measured observations were taken. The referral section displays any referrals to specialists done during the encounter. In 2021, this section will keep referrals within the CED for 36 months. The rest of the report sections will reflect a rolling 12-month display. The immunization section displays immunizations done during the encounter with the name, date, and lot number. At the bottom of the report, you will see the disclosure statement. This reads that the document lists the patient's encounter information from participating clinics. It does not represent the patient's medical history or summary. The provider must verify the accuracy and completeness of this patient's information prior to treatment decisions. This statement is aligned with the terms of use of Netcare. All information is as is, and providers use their clinical judgment. Early evaluation data from the Health Quality Council of Alberta, HQCA, as well as stories documented by clinic teams live on the program, has shown that patients and providers are already realizing the benefits of the CED. Emergency department physicians are accessing CED reports and have expressed that they no longer feel like they are flying blind, and are now able to use key information from the community to inform decisions and are reducing duplicate referrals when the right information is available to them. As I mentioned on the previous slide, the CED is formed from select data from community EMRs. This slide is an example EMR training tool for TELUS MedAccess clinics. You can see that the select CII CPAR data has been mapped in the EMR, and it is clear that only these defined fields are where the CII data is pulled from to populate the CED report. We have training slides for every participating EMR to ensure providers and teams are well aware of what data they are sharing before they participate in the program. There are also EMR posters with mapped sample CEDs that can be left with clinic teams as a quick visual training aid, as well as a detailed EMR CII CPAR guides that are available online. So where can health providers and teams find the CII CPAR CED report from participating clinics? A folder was added to Netcare in 2017. The folder is the Community Reports. If you look on the left-hand side of the patient record in Netcare and you hover over an entry, you can see some data. It's important to note the data flows from the clinic CII CPAR go live day forward. Information from before go live is not pulled from the EMR. So again, the CED does not provide a summary, only a rolling snapshot of the last 12 months. For more information on the CII CPAR program and to access training tools and additional support material, please visit the CII CPAR webpage for practice facilitators.